Okay, so like, let's be real for a sec. When you're pregnant, your brain is like already a million tabs open, right? Doctor's appointments. Did I eat a vegetable today? And those, oh man, those pregnancy cravings. Who has the actual brain space to think about like teeth? But so get this, during my last pregnancy, I stumbled on this totally wild fact. Taking care of your teeth, it's like way more important when you're expecting, and not just for you, but for the little, the little one too. So that's why we're doing a deep dive today, all things pregnancy and oral health. And to like help us break it all down, we have an expert with us. We're going to walk us through why this connection, this teeth pregnancy thing is so important and what it actually means for those, what is it, like 40 something weeks and beyond.
It's crazy how often we like put things in boxes, like, oh, that's a pregnancy issue or that's like a dental thing. But pregnancy, it's wild. It just like throws all these hidden links right at you.
Right. It's like your body is suddenly this whole, I don't know, like this crazy interconnected system, right? Okay. So let's start with something I know, like firsthand, those legendary pregnancy cravings. I basically survived on like watermelon and anything vinegar for like a whole month. And I mean, I wasn't exactly hitting at the candy jar every 5 seconds. But even healthy snacks, if you're constantly munching, it's got to do something to your teeth, right?
Oh, you are totally spot on. It isn't just about what you're eating, but that how often, And on top of that, how pregnancy hormones totally change the game. We're talking estrogen, progesterone, everything's going haywire. And one side effect is your gums get super sensitive, way more prone to like inflammation.
Wait, are you serious? So those hormones, they're behind the mood swings? A&D, angry gums? Come on, that's not fair.
It's true. And because of this whole sensitivity thing, a huge percentage of pregnant women, like 60 to 75%, they get gingivitis, which is just a fancy way of saying, inflamed gums.
So it's not just me then, like, being all paranoid about my gums blighting a little. It's actually a normal thing.
Totally. And we often think of gingivitis as no big deal, but if it doesn't get treated, it can become something called periodontal disease.
Periodontal disease. Okay, yeah, that sounds like a lot more serious. Is that?
Yeah.
Like gingivitis is, I don't know, like way scarier cousin or something.
Yeah, you could say that. But yeah, no, for real, it's actually a much bigger deal. We're talking like potential bone loss around your teeth, which, well, that can lead to losing teeth. And the really, I guess, kind of scary thing is studies have shown a link between periodontal disease and preterm birth and low birth weight in babies.
Oh, wow. Okay. No, you're good. I'm adding flossing queen to my like pregnancy vision board right now. So we've talked about how pregnancy messes with our own mouths, but what about the baby? When does all this like oral health stuff even matter for them?
Okay, so get this, and this like totally blew my mind when I first learned it. Your baby's teeth, they actually start forming crazy early. We're talking between months 3 and 6 of pregnancy.
Wait, what? Seriously? So while I'm over here battling like morning sickness and trying to sleep without looking like a beached whale, my baby is already working on their little chompers. That's insane.
Right. It's pretty wild when you really think about it. And this is what makes it even more important for, expectant moms to really stay on top of their oral health. Because if you have any untreated tooth decay, it can actually be passed to the baby.
Oh, come on. That is so not fair. How
Ooh.
is it like a genes thing?
It's not like genetic exactly. It's more about the bacteria. Remember we were talking about those cavity creeps? Well, those little guys can actually be transferred through like the simplest things, sharing utensils, even just a kiss.
And so you're telling me those adorable baby kisses, they could be secretly harboring like tiny little sugar monsters. That's both like the cutest and most terrifying thing I've ever heard.
It just goes to show how important those like everyday habits really are. And, just to put it in perspective, children are 3 times more likely to have cavities if their moms had untreated decay while they were pregnant.
Okay, wow. Yeah. No, this is getting real fast. Enough of the scary stats. Let's talk about what people listening can actually do, like to protect their smiles and their little ones, future chompers.
Yes. Okay, so the good news is a lot of it is really simple, proactive stuff.
Okay, I'm all ears. What's the game plan for a healthy pregnancy smile?
First and foremost, those regular dental checkups, yeah, those are still crucial during pregnancy, non-negotiable. And good news, they are totally safe.
Oh, thank goodness. There's like this idea out there that you should put off any dental stuff till after the baby comes. But it sounds like staying on top of those appointments is like key.
Absolutely. And then Obviously, your at-home hygiene game needs to be strong. Brushing, flossing, the whole 9 yards, you know the drill. But I do have an extra little tip, especially for those dealing with the joys of morning sickness. Rinsing with some baking soda and water after those lovely episodes, that can really help neutralize the stomach acid. That stuff can do a number on your enamel if you're not careful.
Ugh. Yeah, tell me about it. I remember feeling like my teeth had like a weird sweater on after.
Definitely not the best feeling. And speaking of weird feelings, those cravings, am I right? They're intense. But try to make those food choices work overtime. Focus on the good stuff, fruits, veggies, lean proteins, all that. Good for you, good for the little bean, win-win.
So basically channel my inner like green smoothie goddess, even when all I want is like pickles and ice cream.
Exactly. It's all about finding that balance. Now, we've tackled the pregnancy part, but what most people don't realize is that a baby's, whole oral health journey, it starts way before those first little teeth even think about popping through.
So we're talking like even before there are actual teeth to brush, pre-brushing.
Yep, exactly that. Breastfeeding is amazing, obviously, but there's still natural sugars in breast milk. So even before those little teeth make their grand debut, gotta gently wipe baby's gum after every feeding. Just a soft, damp cloth does the trick.
Makes sense. Start those healthy habits young. But what about when the teeth DO finally make an appearance? What should we be thinking about then?
That's when we got to be really careful about something called, it's got kind of a scary name actually, baby bottle tooth decay.
Baby bottle tooth decay. Okay, yeah, that does sound a little ominous. What is that exactly?
Basically what happens is sugary liquids, like if milk or juice, hang out in a baby's mouth too long, it's like a playground for those cavity bugs we've been talking about.
Ah, so even though it's like milk, it's still sugar. So are we switching to water only for bedtime bottles?
You got it. Water is always the best choice, hands down. And we want to keep those gums wiped down regularly even before the teeth come in. And then once you've got those first little teeth, switch over to a super gentle brushing routine. And of course, those early dentist appointments, can't forget those. Taking your little one to a pediatric dentist early on can really help prevent any, issues down the road.
So much good advice in this episode. It feels like we did a crash course in dentistry.
Yeah.
But it really shows you how important it is to think about prenatal care in this holistic way.
Totally. It's not just about those 9 months. It's about those long-term impacts for both mom and baby. Everything's connected.
Yeah, like a ripple effect. What we do now matters way down the line. Well, I am feeling very informed and, gotta say, pretty motivated to up my own brushing game right now. Thanks so much for joining us for this deep dive.
Yeah.
I think everyone listening is going to walk away with some really great info about pregnancy and oral health, and maybe even some new things to talk to their own dentists and doctors about.
For sure. Knowledge is power, as they say, especially when it comes to our health.
Couldn't agree more. And on that note, happy brushing, everyone. We'll catch you on our next deep dive.